Come in, come in.
Hi, Mrs. Bachman?
Yes.
Hi, my name's Elizabeth Blunt. I'm the nurse
Hello.
practitioner today. And,
This is my daughter, Deb.
oh, hi, nice
Hi,
to
how
meet
are
you.
you?
Just
Nice
give
to
me a
meet you.
second, let me wash my hands, and I'll be right with you. I understand this is your first visit to our practice?
That is correct.
Good, well, it's nice to have you here. Would you like your daughter to stay with you during the exam, or
No, I think, I know all the, I think I'll be fine. You get a cup of coffee.
what brings you in today, Miss Bachman?
Well, I've been having pain in my left shoulder for about 3 weeks.
Okay,
And, you know, I've been waiting for it to go away,
okay.
and it didn't.
And can you think of anything that started this? Any kind of precipitating event, a
I
fall, anything like
I
that?
slipped going down the steps, and I grabbed hold of the railing and twisted this shoulder. It's
Okay.
hurting now.
Okay,
And I just felt like I twisted something,
okay,
and the pain is pretty bad.
okay. And have you ever had a problem with that shoulder before?
Actually, I did. It was about a year ago. I was
Okay.
getting my walker out of the car, and it just caught me off balance when I pulled it, and I fell on that shoulder.
Okay. And was there anything that was a problem at that point? I mean, did you have x-rays or were there any injuries or
The
did it just kind of
pain,
get better
I
over
sort
time?
of took Tylenol or something, and eventually it got better. No, I didn't go to the doctor's.
Okay, all right, good enough. I see you have a walker and you're in a wheelchair at the moment. Is this something that's new for you or?
Not real new, no.
okay.
I had polio when I was 7.
Oh, okay, all
And
right.
then
Yeah.
did pretty well for a long time.
Okay.
Had 4 kids and
Oh,
stuff.
fabulous, okay.
And used to travel actually for my company.
Okay,
Anyway, when I was about 65 or so, things just went south. My bad leg and hip just got weaker.
okay.
The muscles were just not as strong, and I began to doctor, you know, with who knows. Then I read about post-polio syndrome. Have you heard of that?
Yes, I have, but
Yeah,
I'm not
yeah.
terribly familiar with it. Okay.
Well, it just means that everything's worn out. Your good
Okay.
stuff and your bad stuff.
So you get fatigued
Very
quickly
fatigued, weak.
Okay.
Yeah.
And do you have problems with falling as a result of the
Sometimes,
fatigue and
yes,
the balance
although
issues?
The wheeler, the rollator, and I have an electric scooter in the house.
Oh,
too.
okay.
Yeah.
All right. Okay, so you can use that for distances.
Yes.
Okay.
Yeah.
All right. So I'm going to ask you to take off your tops. You can certainly leave your bra on. Do you need help to do that, or
My daughter
are you
could
able
help
to?
me if-
Okay.
yeah, please.
Would you like me to ask her to come in and give you a
Yes,
hand? Okay. And would you need help to get onto the
would,
the table?
yes.
Do you need me to help you with that, or would you
I
rather
guess
your
she
daughter
can do
did?
it, yeah,
Okay. All right. Great. And let me get this out of the way here, and we'll get the bed all the way down for you. There we go. And I'll just get your daughter. Just stay there for just a minute, okay?
Thank you.
All right.
Come in.
Hi. Hi.
What do you think?
Well, you know, I did your exam, and I think, like we sort of talked about while I was doing it, you don't have a lot of range of motion in that shoulder, and you're telling me that that's relatively new. You certainly are having great difficulty getting it up above that midpoint, which is concerning, and certainly the amount of pain you're having in relation to your ability to get around with, you know, the walker or whatever other assistive device you need is really concerning. So what I'd like to do is think about a plan that involves some pain management, perhaps a little physical therapy, and see how that goes. So what I really need to know from you is what kind of mobility you have in terms of being able to get out for appointments, or whether it would be a problem for you to go to physical therapy twice or 3 times a week, or should we think perhaps about having somebody come to your home? So,
I don't have any relatives around here.
Okay,
You know,
and-
all my children live far away.
right, and as you said, I know your daughter is in California, so
Right,
that's,
right.
she's certainly not going to be here to take you to physical
No,
therapy twice a week.
no.
So,
I can get a cab if it's not too expensive.
well, that could be pretty expensive. Now,
Yeah.
what kind of health insurance do you have?
I have Medicare, and
Okay.
they're supplementary.
Okay,
insurance.
all right. So we could consider something perhaps like some home physical therapy.
That sounds
Might be able to
That
do
would work out
something
great
like
with
that.
it, wouldn't it? They could come to the house.
Right.
Okay, well, I can certainly look into
But
that.
what's that first thing you said? Did you say I need an exam before?
Well, I think what we need to do, I think it's a couple of things. We need to do the physical therapy, and I think, can look at perhaps having someone come to your home. I think with your post-polio and the fact that you need a walker to ambulate, and the shoulder is really preventing you from being able to do this. We can think about some physical therapy in the home, and we can talk about scheduling that, who would be best available to do that if you're amenable to that. Then the other thing is, I would like to get an X-ray of that shoulder.
Can you do that?
Okay, so you'll be able to get an X-ray. That will be you'll be able to manage
Okay,
that. We'll look at some physical therapy for home. You're okay with that. The other thing I think for right now is the pain management.
Yeah.
Now, I'd like to see you back here in about 2 weeks. Now, is that going to be possible for you?
Yes, you'll be gone, but I'll ask my neighbor.
For any reason that doesn't work, then I want you to just leave a message for me directly that you're having trouble getting to the office. So we can either I can speak to you on the phone, or we can, arrange
touch.
another time
Yes,
for you.
yes,
Okay.
yes,
All right.
Yeah, okay.
Now, the other thing is, as this is the first time that you're here at the office and we're really seeing you for an acute problem, I'd like to see you back additionally at some point for just sort of the equivalent of an annual examination, so we can make sure that all of your screening is done, that things like, flu vaccines and Pneumovax if you need it, if you haven't had it, all of those things are up to date. Mammograms, any other kind of screening testing that you might need. And I'll leave the prescription and the instructions and the X-ray request out at the front desk, and you can schedule that appointment, and we'll go from there.
Right.
Okay? All right, it was
so
very
much.
nice meeting you. Thank you
Sure.
very much.
Thank you. You've been
Okay.
very helpful.
It was nice
All right,
meeting you.
thank you.
Have a
Nice to
safe
meet you.
trip. Okay, bye-bye.
Bye.